Hawk Jewelers, timeless jewelry for generations.
Good evening, everyone. Welcome to the show Fight Against COVID-19. Thank you for watching us and praising our show. We really appreciate all of you viewing our show because with this show, we are able to connect people across states, all over the United States, who are working together as a part of community to help this fight against COVID-19. We have interviewed so far many people who who are making masks, who are actually supporting people to provide food, supporting small businesses, frontline health workers, and many more. Our goal here with this show is try to create awareness so people are connected to each other in their community or outside and can help each other. Today, I'm introducing somebody who's actually working in frontline, an RN or a nurse, who's actually a hero working in Boston. Her name is Sudha Acharya, and she's from Newton Wellesley Hospital in Boston. Welcome, Sudha.
Hi, thank you.
So, Sudha, thank you for being on our show. My name is Shifali Agrawal. I'm your host today. So, I wanted to first, before we get into the fight against COVID-19 or what you're actually doing for COVID patients, tell me a little bit about yourself, your family.
Well, I work as a registered nurse at Newton Wellesley Hospital. I have been a nurse for a couple of years now, and as you know, this COVID, I have never seen anything like this in my nursing career before. I live in Boston with my family, but as a nurse in the hospital, we see a lot of COVID cases nowadays.
So you said that I know that you said you're a nurse and you work in the hospital. I heard that you also teach, right? So tell me a little bit about that.
I work as a nursing instructor in Boston College and Northeastern University. I teach clinicals to nursing students.
Okay. So, you work in Newton Health. So tell me a little bit about how you see these COVID patients and, about your floor and general, how you're involved, because I'm sure there are patients with COVID.
So, actually, I'm an oncology nurse. But with this pandemic, everyone is helping out with everything. So as the surge happened and we started seeing a lot of COVID patients, so we actually moved our oncology floor, and then our floor is open for COVID patients now.
And what do you do, like as a nurse? What are your day-to-day responsibilities when these patients come?
For a COVID patient, it's as a nurse, it's whatever we do for all of our patients as a nurse. It's my responsibility, like whatever I do in my day-to-day life as a nurse. But with COVID patient, it's a little different because with this pandemic, you have to be wearing masks, gowned up, and there's no visitors allowed, so the patient will be there by themselves. So I feel a little bit more responsible than my usual day-to-day responsibility.
And then what is your usual day-to-day responsibilities like, in terms of like how do you help or what are the roles as a nurse? Many viewers may be interested, like what do you do with those patients?
So for COVID patients, depending on how some people come with mild symptoms, usually those who are with mild symptoms stay at home, but sometimes if they have difficulty breathing, if they need oxygen, or sometimes like senior citizens, they're having some complications like pneumonia, they get admitted in the hospital. And so when they get admitted in the hospital, they are there all by themselves. And when they come in the floor as a nurse, I have to do starting from the admission work to trying to settle them down in a new setting. And it's totally different with everyone being gowned up and putting two masks on with face shield. It's hard for them. They don't even know who they're talking to. So I have to introduce them. I have to make sure to let them know they're safe. And if they want to talk to the family, I will let them know that we can use phone or we can use Zoom. That's what we've been doing right now. But first of all, I try to make sure that they're safe and we're there for them.
So like as a nurse, you also have to draw blood and all those things. Like, is that true? Like, what are the other responsibilities that you do, specifically?
As a nurse, we do assess the patient. We check their vital signs, check their oxygen requirement. Like if they're getting if they're on nasal cannula, if they're on a face mask, we try to check the oxygen saturation, blood pressures, and all. We try to give them medications. As a nurse, we give them medication. We make sure eating is really good. Eating is really important when you are sick, so we try to make sure they're eating good. So from serving them, like giving them food to drawing, usually in the drawing blood, drawing labs to checking vital signs, giving medication and making sure they're okay.
So you are actually very close to these patients. I mean, of course, doctors come and visit, but I know nurses are very close. They're talking to them. They're doing blood draws, regular, calls with them in the sense like go every hour or something. Like how do you must get connected to these patients?
We do what we're trying to do right now. It's called clustered care. So instead of going there every 5 minutes, because we need to be really mindful about not wasting a lot of our PPEs. So what we try to do is do everything at once if possible. So let's say if I'm going there to give them their lunch, I will check the blood pressures and vital signs at that time. Give them any medication they need at that time. Make sure if your patient is incontinent, means they need to be changed. Make sure to change the patient at the same time. So we try to do all those.
You try to decrease the number of visits as much as you
Yes.
can to comfort the patient. What are some of the feelings these patients have when they actually, when you're doing that? I'm sure they're alone, as you said. What are some of the things?
The biggest fear with the patient is not knowing what it can cause. They are fine now, and then things might change a couple hours later. Like that, not knowing what they might be going through is the biggest challenge on them. And on top of that, not being anyone around, not being able to like talk to their family. We talk about Zoom and FaceTime, but not all the people are able to use this. Some people like our senior citizens, they're not. Sometimes they're hard of hearing and they don't have hearing aids. It is very hard for them to talk to and use all this electronic way of communications. And like I said, with the mask, double mask, if they are hard of hearing, with the face shield, if they have hard time seeing us, it is very hard for them to hear us. So we have to be literally like yelling at them, not yelling, but we have to be very loud. And obviously they are stressed, anxious, um, feeling lonely, alone in there. Um, that's what I have been seeing with the patients lately.
It must be tough for you, seeing all this, like you said, you've never seen something like that. Tell me, how do you feel when you're in the surroundings?
So when I'm home, I'm more anxious. When I'm at work, I feel much better because I see my friends and everyone around. Things are a little different. Our day to day, like usual norm, is different now. We try to keep distance apart whenever we're doing things in the hospital too. If I'm pulling meds in the med room, we try to make like 6 feet distance among our coworkers as well. So it's and obviously it's anxious for everyone. Not like I said, not knowing, and fear of getting disease and bringing it home to your family. It's the biggest fear for all the healthcare workers right now and all the frontline people.
No, we really honor your work. I think, I mean, it's really difficult to actually risk your own life and your family by going and treating and being in front line. It's really, I think it's remarkable what you're doing. And we really appreciate that. And we really honor that and salute you guys for all the work you're doing. When
Thank
you
you.
actually, some of the things that you were talking about, in terms of symptoms, what are some of the common symptoms you see?
Um, First common symptoms we see, like there's a flu, fever, chills, rigors, sore throat. Some people come with nausea, vomiting, diarrhea, um, very high fever. Those are the common symptoms we usually see. And difficulty breathing, obviously, is a major one. People are needing oxygen to breathe. Some people are on high flow oxygen. Um, those are the common: difficulty breathing, coughing, nausea, vomiting, and fever. Common that I have been seeing in my floor.
So, you mentioned the fear of, come bringing that back to your house. Why do you do all this?
I became a nurse because I wanted to help people and I love my job. So I have seen death. I knew it when I chose this career. We came across a lot of other communicable disease. Just because it's different, I didn't feel like not doing it.
Yeah.
I always care for my patient and I wanted to be able to help. So
Yeah.
I feel really great, even though I'm anxious at one point, but I feel really great that I'm being able to help and
Yeah.
make difference in someone's life, you know. Um,
Yeah, no, that's great. I think we have somebody who has a question. If we can get that question for Sudha.
Hello.
Hi.
Hi.
Hi, I'm calling from Boston, and I want to know, like, what is your because this is a life-threatening disease. Like, everyone is so paranoid about the situation, and everyone is so scared of this disease. So, how do you feel like being in the front line, being like while treating the patients? What is your emotional this thing? Because even your life is at risk. So, how you are able to like treat them with with the same like I want to know the emotional this thing of you like being in the front line.
Thank you.
Are you like
Thank you.
scared, or are you like are you able to do with the same love and care? How is it like?
Thank you. Thank you. That's a really good question. I would not lie. Every day I'm in the car to drive to work. I have to take a deep breath. When I come home after work, if I sneeze once, I would be scared, thinking that, oh my God, did I really got the COVID? But as a nurse, like I said, when I go to the room, I just have to be mindful about putting adequate PPEs, putting my N95 mask, gowns, and proper hand hygiene. So once I go inside the patient's room and I talk to them, sometimes I kind of forget that they had COVID. They have COVID. Once you start talking to them, I kind of have thing in my mind. I have to be faster than normal. Like I have to do my things really quick. That means I'm trying to minimize my time that I stay inside the COVID patient's room. But I wouldn't lie, it's scary. But once I go to the patient's room and I try to help them do some nursing skills like drawing labs, I wouldn't be like I would forget for a while that I'm drawing labs on a COVID patient. I would do my things however I do with my other patients, but then you will remember again. Okay, I have to leave the room like as soon as I'm done.
No, that's a
It
great.
is.
Yeah, it's tough, and it's a great question from the caller from Boston. Thank you so much for your question.
Thank you. It's a good question.
Thank you for doing this for everyone.
Thanks.
So, I know you mentioned how you feel and also what's going on. So, in terms of, in general, what is your motivation? And of course, you're a nurse. What motivates you to get up and say, okay, I got to go do it, and I have to take care of these patients.
I got up, I think a while, and then say I have to go because if I don't do this, if every people start thinking like this, then who's gonna help them out? I think of what if my mom is in the hospital? What if my brother, my sister? It can be anyone. What if someone refuses to take care of my brother, my parents, if they're sick just because they have COVID? So I try to think that way. That gives me motivation, and once I go start seeing this patient, the fear in them, and once I try to connect them with the family, the facial expression they have, the smile they have in the face, and the really good thing is when they get better and we get to discharge them, makes it feel a lot better, worth it.
It's definitely worth it. First of all, I want to really, really thank you for all the great work you're doing, risking your life to save ours and your family. So really appreciate that. Thank you from our TV, from my side. It's really an honor to have you on the show. Before we go, do you have a message for the viewers?
Um, yes, stay safe. staying home. It's not just from me. All the healthcare workers, we're very thankful. All the frontliners, we're very thankful. We have received a lot of appreciation from all of you. That also motivates us to get up in the morning and go to work, or maybe get up in the middle of the night or go to work. Thank you for appreciating. And you are also doing your part by staying home, following the order, maintaining social distancing. Stay safe, perform the hand hygiene, follow the social distancing. That's all I can say.
Now, thank you. That was a great message. I think with this show, what we are trying to do is try to create awareness so people get connected and appreciate all the great work you, the frontline people, the people behind the scene, like people who are making masks and so many things come highlighted. So thank you again for doing all what you're doing. And please take care of yourself and be safe yourself as well. And to your viewers, please be safe, stay home, and stay strong. Thank you so much. Thank you, Sudha, for the show.
Thank you so much. Thanks for having me. Thank you.